to the April 8th Board of Health meeting. Basically, this meeting is only dealing with COVID issues. So I have my notice to read before all Zoom meetings. This meeting is being held virtually through Zoom. People that join the meeting are set so their microphones are muted so that the meeting can occur in an orderly fashion. We ask that people we request the participant return their microphone back to mute. Okay, so we have a lot to talk about today.
Louise, I have one more comment. For those joining by phone, if I mute you, then you won't be able to unmute yourself. But if you use *6 to mute and *6 to unmute, that would be very appreciated.
Thank you, Judy. Okay, so I have a couple of things I would like to get to first before we get into the bigger issues. So first of all, there is a new phone number that has been set up, and it's for Nursing Home Family Resource Line. So the Baker Polito administration announced the launch of a new nursing home family resource line, a dedicated telephone line that will connect family members of nursing home and rest home residents with the information and resources they need. This resource was created so that family and community members have one central contact that they can reach out to if they have questions or concerns about the care their loved one is receiving during the COVID-19 outbreak. The line is staffed from 9 a.m. to 5 p.m., 7 days a week. Staff will coordinate across state agencies to help callers find answers to their questions. Family and community members can call the line at 617-660-5399. And if Janet, maybe you could add that to the chat box so that people can see it.
Mm-hmm.
Okay, and then I would ask Jim Gareffi to give us an update.
So we're following the, all of the updates that are coming out through the Department of Public Health. The newest one talking about the supermarkets and making sure they are enforcing that social distancing. The governor tightened up a bit on the requirements there. So as our food inspector will go out and make sure they're all following those procedures. It's still in contact with Life Care and their staff and the Department of Public Health to try to figure out and make sure the board can do their isolation and quarantine role. And I'm still taking some calls from families on that. And I guess that's it for my updates at this point. That other point that you had mentioned earlier on, Louise, about the hotline for families for nursing homes, that came out yesterday with that supermarket update.
Mm-hmm. So, Jim, can I read an email to you? It's about masks.
Okay.
So a woman, actually, I don't even know if it's a woman, but it starts out, I went to 2 businesses today and was not impressed with their efforts to protect themselves or their customers from spreading the coronavirus. First, CVS. About half of the employees behind the pharmacy were wearing masks. The person who helped me was, and I thanked her. I also went to the post office and in conversation with the employee taking my parcel, who was not wearing a mask, asked if they needed masks because I'm going to stop making them. And she said, no, they weren't needed. I told her the masks weren't to protect the wearer, they were to prevent the wearer from inadvertently spreading the virus to others. She responded that she was not wearing a mask due to personal reasons. I think all employees should be wearing masks. Can anything be done to strongly encourage this, if not mandated? I'll try to tune into the Zoom meeting tomorrow. Thanks. So can we talk about the masks a little bit, Jim?
So CDC at this point, if you go up to the website, they have it as an advisory. So at this point here, again, I'm not sure what you can enforce with just an advisory unless you were going to try to do something locally, in which case I just left a public health call. The folks on the public health call said, and if you mandate mask wearing, how are you going to enforce it? Where are you going to get the masks? So again, it creates another level of complexity that I'm not sure the board is equipped, or anyone at this point, given the equipment shortage, is equipped to handle. I think the important thing is that social distancing piece. So again, staying away from people, even at the checkout counter. When I was up at Market Basket early on, they were talking about asking people to unload their groceries at the end, at the very beginning of the belt, so it minimized the time that they were within that their cashiers. So techniques like that, I think, are ways that people can protect themselves from that.
Okay, thank you. So can you bring us up to date? Let's start talking about the Life Care Center. I'm sure that's on a lot of people's mind.
So again, we've been working with DPH just to try to work out, make sure we can do our job as the Board of Health with the isolation and quarantine. So I know after the weekend meeting, we provided them with a list of things that needed to happen. They've received those. They are making the calls to Tamara at the end of the day. Tamara has had a couple of calls. I think she's actually maybe on one now while we're doing this, with Life Care and the state, trying to figure out how we can actually do the isolation quarantine piece of it. I had sent Eileen McHale, who's the person we're dealing with at Bureau of Healthcare Safety and Quality, kind of a list of questions and concerns based on Tamara's conversations yesterday with Life Care, the state, and the state's epidemiologist, one of the epidemiologists from DPH. And so I'm sure Tamara's talking with them about those concerns now. I will call Eileen McHale at the end of the day to follow up with her on the email that I sent her.
Okay, great. The other thing we need to talk about is, I don't know where the numbers are coming, but a lot of people are posting numbers that they received, that there are 65 people at the nursing home that have tested positive. And since I have not seen that number, I don't know where they're getting it. So can you speak to and I know it's a topic of conversation. People want to know numbers, and we have not been giving that information out yet, and we were supposed to continue that conversation today. So Jim, can you please update everyone the status of positive cases at the Life Care Center and positive cases in the town as a whole?
So let me, I guess I looked at our list and this is from the 7th, and the numbers I have, again, some of the people who are at Life Care do, particularly staff, don't live in town. Not all of them live in town. So if they're positive, we wouldn't necessarily have those numbers.
Right.
So through the 7th, I had 60 residents since we started keeping track. So this is like March 28th, who have tested positive, and 6 staff members. Now, some of those tests may be pending. One of them was inconclusive. So those are the numbers I have from the state lab. Those are the reports that I have from the state lab. The numbers that I think have been out there, it looks like, and I got it earlier today, that the Life Care put out a memo with numbers on it.
Yeah.
That's and it seems to align with those numbers that have been up on the HDH report. Numbers for Littleton, just the town itself. It's going to take me a little while to do some quick calculations here. So as of Friday, they were 6. So the 3rd, they were 6. Let me just take a look at the sheet and give you as up-to-date a number as I can as of yesterday. Let's see. So that would have been 6.
And while Jim is working on his figures, I would just like to caution anyone from putting numbers out there that you get from HDH, because I don't know where they're getting their numbers. If we didn't know the numbers, I don't know how HDH got them. And so I would not, please don't post numbers like that. It creates panic and chaos, and people worry. So I would be very, very hesitant before you posted any numbers.
So Louise, it looks like, since we started keeping track, 10 residents.
So you have 10 residents are positive and 60 life care residents are positive?
Yeah, and there's 6 staff that we have on our list. I'm not sure if all of those staff are in the town or not.
Okay. Okay, I guess let's open it up to other board members. Is there any other comments for Jim or anything you want to bring up?
This is Mike. Do you want me to mention some of the items related to Jim's report?
Sure, Mike.
Okay. First of all, my question to Scott is that has your situation with respect to necessary equipment for your staff, has it been replenished, or are you being basically reusing everything that you've got? Not necessarily that's a wrong idea. I just want to know whether or not you are, shall we say, still up to standard, your standard of being prepared for the, I hope, doesn't occur event.
Currently, we've received 2 shipments from the National Guard. One last Saturday, and 2 weeks ago Saturday, sorry, and last week Tuesday. And we've also had some very generous donations from different individuals in town and a couple of companies. So right now, we are in pretty good shape with suits, masks, eye protection, booties, gloves. We're in good shape for a few more weeks. Obviously, that is going to depend on the amount of calls that we receive that may be COVID related. One thing for everybody to keep in mind: every single call that we respond to in town, be it somebody that needs an ambulance, we are taking some form of precautions. So that there are people in town that think, that why are you coming into my home wearing a mask and gloves? It's for our safety and for your safety, because we don't necessarily know exactly what everybody have. But in general, we're in pretty good shape right now.
Great.
Scott, before we move on, before you ask another question, Mike, Scott, can you update everybody the process that you go through for every call? I mean, I've heard you say it on the Board of Selectmen meeting, but I don't know if we've said it here or not. And we've got a good audience here that I think people would be impressed at the lengths that you have to go through.
Sure. So everybody, for every flu-like call that we receive in the station, it may take us an extra, minute or two to get out of the station. But before they leave, they put on a full Tyvek suit with a hood, booties, gloves, a N95 mask, and either goggles or glasses. And then when we go to the facility, they'll go into, say, Life Care. One of the staff members have been assisting us bringing the patient out and loading it into the ambulance. If it's a larger person or a more complicated issue, then we'll have a second person also gear up in the exact same fashion to go in and assist. When they're done, they will decon the back of the ambulance. They wipe everything down. They spray it with electrostatic sprayer, virus killer. Remove all of the PPE. Somebody assist them, turning it inside out, taking it off. Then everybody, they change their uniform, they shower, clean clothes, and while somebody else completes the decon of the ambulance and the equipment. And then we'll start it all over again. We have 2 ambulances, so we've been alternating them, or in many cases, they've both been running at the same time. At this point, I'm still very happy to say that everybody, all of the responders are healthy. We don't have anybody sick. And I would attribute that to taking these full precautions and constantly washing and cleaning as soon as we can.
Thank
Uh,
you, Scott.
Yeah, just a quick question for Scott. What is the relationship or advisory after a responder has participated in an event or gone into a house or whatever and being, shall we say, retested? And what prompts this is the availability, somewhat increased availability of testing, is in particular for first responders.
So if somebody is concerned, the testing has been changing on a daily basis. If somebody felt as though they had a symptom, we could send them down to Gillette to be tested. But if they don't, we're not just randomly sending people to get tested. If there are no symptoms, then there is no need to go and be tested. As long as they continue to follow all of the procedures that we have in place, they should be in good shape. But if there is a concern, we have in fact sent a couple to be tested, and they've come back negative.
Good. Well, I mean, I hope your entire staff is at worst asymptomatic, even if they're positive. Yeah. One of the problems it's one of the major problems that everyone has, that we just can't afford or we don't have the resources to do real testing like we can for the flu and for other diseases, where there are millions upon millions and millions of, shall we say, test materials available here. You can tell by just going to the site that CVS has set up in Lowell and see the criteria that you need to fulfill in order to get tested. There's a shortage of testing, and it's going to hurt for quite a while.
It's changing day by day. There's another, is it the Lowell facility that just opened with 15-minute testing, and they're claiming that they can test 1,000 people a day. So it is changing, day by day, week by week. It could be improving.
Yeah, I noticed the criteria. Improving would mean, if it improved significantly, it would basically be a little, shall we say, a little bit more specific about who gets tested and who doesn't. There would be real criteria set up. What's set up right now is you practically either have to be diabetic, have congested heart failure, whatever, as opposed to first responders.
Again, that's changing. I know since they have opened, if you have symptoms as simple as a dry cough and a runny nose, things have been tested on that level as well.
Yeah. No, this is not an argument about the growing availability of testing. It's just that we can't do the kind of detection that's necessary. And I'll get to it when Louise allows, but we have to be, as it were, in brief, we have to continue the process of distancing for far longer, perhaps well into the summer, because we just don't know enough about whether or not the population that has gotten the disease and recovered from it is actually protected immunologically. That is, they won't get it again. So, and how long the virus itself is maintained in the population. And given the tricks this virus has already come up with, the unknowns have to be answered. And just to agree with Scott on how things change so rapidly, I put together some of the concerns about making sure we don't relax even after this week or the week following or well into May or June. The National Academy of Sciences has just released its advisory. I think it was last night or during the day. And it summarizes what I already have in the sheet I was going to talk about. And basically, it means that we may not be able to relax social distancing for quite a number of months maybe until even a vaccine becomes available. And that's 18 months. That's going to take some part of a year, most folks estimate, before we're there. That's an extreme, but there are issues. And using symptoms as the trigger for doing a test doesn't really address the problem of spread. It just happens to be the one we can use, and the only one we can use, because we don't have enough testing materials.
Okay, Jim, would you like to speak to that?
The testing piece of it, again, the new site opened up in Lowell. I went to the site last night, and it's day to day. It's out, so you need to go there. The state still does have their testing protocols for obtaining tests at other locations. So that part hasn't really changed. So I don't have anything more than that to add on the testing piece.
You can't get tested in Lowell unless you pass certain criteria. The CVS had them set up.
Sure, and same thing with the Department of Public Health has that criteria listed. That's how you currently, even before the CVS site, that's how you got tested, was through a set of criteria.
Right. So that tells you that the again, I'm just repeating, the amount of materials needed for testing are in very, 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 very short supply. And so this means that we still don't have, shall we say, enough understanding about how this virus really spreads and recovery, and how well protected are already infected people recovering. They're going to be post recovery, because if the response is, shall we say, very short lived, that would mean that folks who had recovered become carriers. So we can only hope that this virus acts more or less like its close other relatives, where the immunity is, shall we say, is retained over a longer period of time, sufficient to give us time so the population that has not been exposed to the virus, including the entire population, can be vaccinated.
Okay.
I'm just trying to prepare us for a longer haul for this. That's all.
Yep. Thank you, Mike. I think Lisa had a question or a statement.
Yeah, I had a question for Scott and maybe Jim. Scott, how long is the turnaround for your results? Are you guys are they doing a different test for first responders? And while you're waiting for results, are your guys and girls out of work?
For us, it's been 24 to 48 hours. And the guys that were out on testing, they were off duty, and they stayed home. They self-quarantined. That's
Mm-hmm.
what you're supposed to do.
Mm-hmm.
And looking at the life care, when the National Guard went up there, it looks like it was also 2 to 3 days for testing to come back, just based on the reports that we're getting.
So I guess another question: when that happens, Scott, are you understaffed? And do you have some? Do you have I don't know, volunteers or some kind of backup, or is it just a regular staffing issue? And the same thing with Life Care. Did they have enough staff when those people were out being tested?
As far as we're concerned, we've put on an extra person on all of our shifts. Just the extra hands definitely make life a little easier, trying to help getting everybody dressed and undressed. But so right now we're just really relying on the coverage of our career staff.
Okay.
I have a question for you, Scott. When you go for testing, is Shirley a testing site for just first responders, or is that true?
Sure. Shrewsbury.
Shrewsbury. Yeah. Sorry.
Right. Shrewsbury is for fire, police, nursing. Actually, yeah, I think it's closed now. I think Gillette is the new for again first responders, as well as the prison guards.
Thank you. Okay, I believe there was a question on the chat line. Janet?
I have a question for Jim, if that's all right.
You'll be next, Kevin, okay?
Sorry, the question on the chat line is, are there restrictions to the LLC staff's movements around town if they're in question of having been exposed, and also within or between the wings of LLC?
So I guess I'll take a crack at that answer there. So if a staff person was out for testing, they should be asked to stay indoors, essentially self-quarantine until the results come back. So they should be staying out of the public in that case there. If they have procedures inside the house, inside the Life Care Center, where they're wearing proper PPE, they need to follow those procedures inside the house to make sure that they're not either leaving the facility in a state where they may have been exposed and have that potential to infect, or move between wings to do the same thing. So it's really a procedural thing inside the house, make sure they're following their proper infection control plan and their PPE plan.
Okay. Kevin, your question or statement?
Jim, I was just wondering, how are you reacting to Governor Baker's, contact tracing strategy? And is there a way to tap into partners to try and utilize some of their boots on the ground, let's call it, to help out with that?
So two calls I was on today, they were kind of, this is a process or project that's kind of being developed as we move.
Yeah.
And so the calls, each one of the calls I was on gave us a little bit more information. We're definitely going to take a look into it. They haven't completely rolled it out yet. They need to get us a supervisor, us being the health department, a supervisor. And it sounds like it would be a very, very helpful thing because they would end up doing some of that contact tracing for us.
Right.
So we'd open up the case, we'd start the initial case. Again, this is all new, so I'm telling you what I heard on the call. We'd click on a box and they'd pick up doing the contact tracing piece for us, so we could continue on to the next.
Oh, that's good.
Person and start that process. So until we see something in writing, this is what we're hearing on the phone. But I would be very excited for any kind of help like that.
Yeah, I guess like they're training 1,000 people, so hopefully we can get one.
So they sounds like they've got 9,000 applicants already.
Oh wow, that's awesome.
So it sounds like the response is there. Good.
And just in your response to Louise had asked about the masks, I know that it's not a mandate right now, but we could do something locally to mandate that public employees wear them just to protect themselves and people that they're serving. Correct.
I guess that would be something. Again, one of the calls I was on earlier, one of the communities was thinking about doing that, and the rest of the group was kind of piping in. How do you enforce it? How do you get the supplies? How to? So,
I mean, maybe it's just a thing where we're able to source the masks and provide them to the people, and when everybody's wearing them, and that's the world we live in right now.
Yeah.
Maybe it doesn't have to necessarily be enforced, but to be able to source them and provide them and just try and protect people a little bit.
If the board wanted to make a strong pitch that people, particularly when you're in an unavoidable situation where you're that close, it's advised to be wearing masks. And again, any of the sources that we use, either for our nurses or for our dental staff.
Yeah, they're flat out. Right?
Yeah, good luck trying to get masks.
Yeah, I know.
Yeah, so.
Yeah.
If I could chime in on that one, if when you're out in public and you can find some of those homemade masks, wear them. They're great. Don't, only thing I would say right now.
No warranty, right?
No warranty, but as far as the N95s and stuff like that, we're still, I wouldn't say that we have an abundance of them, and would really like to, try to save them for the first responders and the nursing staff. So I would say, folks using that stuff out in the public, by all means, there's a lot of really handy people out there making a lot of these masks, and they'll suffice. You shouldn't be within 6 feet of each other anyway when you're out in the public. And if you wear it while you're out there and it protects you, and it protects the other people from you, then that's even better.
Maybe we can, brand them and put a little Littleton logo on them and, donate them or something. We'll see. So the testing situation, Jim, are you aware of this ID Now COVID-19 5-minute test that Abbott Labs came out with?
So I think that's probably, I'm not, I saw the thing you had sent along. I think that's what's being used up in Lowell. It certainly sounds like it.
Their office is in Westford.
Yeah, it's a matter of whether you can get the device or not. And
Yeah.
they have, in that material you sent over, they had the little insert that goes into the box,
Yeah.
and you kind of read through it. There's still supplies that are required, still trained staff that's required.
Yeah.
have
I mean,
no
if
idea-
we could get Scott one of those things,
the fact that they're still kind of,
that would be amazing.
I think Littleton was, I mean, the CVS was kind of the, there's not a lot of them, it sounds like. Maybe there's 3 sites in New England, Lowell being one of them so it sounds like the machines are pretty tight supply-wise already.
Yeah, and as far as CVS, you know, they're closed in Shrewsbury, and their new location is in Lowell.
Yeah.
But really, you know, to open those facilities, they're manpower intensive, and to, you know, have the right equipment, the training, and the way to, you know, really keep all the paper trail that goes along with it.
Mhm.
It's definitely something that has to be set up through a facility like that, and not necessarily just, you know, done.
Don't send them to the fire department, right?
Yeah.
Yeah.
It's another thing. We just don't have the staffing or the
I know.
manpower, the PPE and stuff like that to accommodate something like that.
Have you heard about this Mass Response website that the state set up? What are your thoughts on that? To like try and get some extra manpower and people that are trained in the field.
We are part of that. The volunteer corps. Alex McCurdy's on this call. The CERT team, the Littleton Volunteer Corps, has members of the Medical Reserve Corps as well as the Community Emergency Response Team. The MRC goes through that mass response. We've had members that have been requested to assist in call centers.
Okay.
As part of that. But, you know, right now those volunteers are pretty much maxed out across the state.
So how does that work? You put in a request?
The state would.
Okay. So if you needed people, you would put in a request with the state to see if they had any extra volunteers?
So the state has set up some of these large centers. They have larger call centers to keep track of positive COVID patients, so that they can, you know, track them for their 14 days. Yeah, Alex could probably get into a little bit more detail on that.
Well, you know, I'll Jim, if it's all the same, I'll try and maybe source one of those testers for us, you know, somehow, some way. Just do some legwork. And, you know, I don't know if there's anybody at the state you can call DPH, but it seems like it might be a little bit more efficient than sending people to Gillette or up to Lowell to spread the COVID around.
I guess my thought on those machines, I'm sure everyone that's being made is probably accounted for, and I'm sure they're going to be used where they get the biggest bang for the buck, like the CVS site. So, I guess it certainly can't hurt to give a call, but, you know, even if you got a machine, you got to get the supplies. And like Scott said, it's a whole logistical setup of, you know, not just the site, but the testing and the reporting and the trained staff. You know, it's not, the machine would be nice, but I think those machines are going where they can do the most work with the right people.
Right. Yeah, maybe it's worth reaching out to CVS in Littleton, to Sarah Albanese, because I don't think it's, it might be more appropriate for people to utilize that location for something like this than to go buy Easter candy.
That will not happen in this town. Our CVS is not set up for a facility that can accommodate that. We kind of checked into that in the very beginning, and it's in Lowell in a wide open area. There's no way for our town to accommodate something like that.
How big of a building would you need?
It's set up in tents in parking lots.
Tents in parking lots.
It's out in the open air. You need all of the staffing and the equipment and the resources to go with it. And, that's not something that we have the ability to provide.
Mm-hmm. What if, as a part of our emergency plan that we have for the town, how would we implement that emergency plan if we don't have the resources?
We have the ability to shelter, not to do testing. That's a much larger thing, and that's why it's set up across the state in these strategic locations.
Okay, Kevin, I want to interrupt you and let Alex McCurdy respond.
Oh, sure. Yeah.
Okay, thank you. Can you hear me?
Yes.
Okay, the way the communication chain that the chief gets and the communication chain that I get are slightly different. The stuff comes in to me through the Medical Reserve Corps. Now, that's a statewide group of corps. Some are local, some are groups. And they periodically put out requests. And if we have somebody that can match the needs that they put out, we will ask them if they want to go to that location. So far, we've responded to 4 requests. That doesn't mean we ended up with personnel there. That means that we have fielded 4 requests, and I've evaluated whether it was reasonable for us to send somebody and if we had the right people for the job. So those are coming in, about 1 a day. One Sunday, 2 came in at once. And at that point, what I do is I contact the chief, we talk about it a little bit, and then I enter into a discussion with the particular volunteers. As far as what they're looking for the most now is RNs, and we only have 3 of those. And the circumstances in this case were that we're not going to be able to deploy all 3 for any of the things that they've asked for yet.
Okay, thank you,
And
Casey.
my comment was just more about maybe utilizing that service to bring folks and train people into Littleton to help us if we need them, kind of a thing.
Are you referring to utilizing our services?
Yeah, and other folks that have volunteered on the mass responders.
Well, there are literally hundreds of MRC people across the state. And some of them are much more attuned to what is going on right now than we might be. I think the chief alluded to the fact that we were originally set up to be operators of a shelter, and we've sort of been branching out since then, but we don't have a large medical component. And right now, it's the medical component that's necessary. There's only been 1 request that I've seen where it was a volunteer, any volunteer. So I think people that do not have a medical background, there's plenty of those volunteers around. Right. So we're ready and we're here, whatever the chief may need at any given point to work here. But I don't see us being moved out of town in any great numbers. 1 or 2 people to assist in niche sort of situations, and that would be it.
Thank you, Alex. Is there any other board members that have any other comments? Janet, are there any other comments from the public?
Could I just say thanks to both the chief and to Jim for keeping us so well informed and protecting us?
Mm-hmm. Definitely. Thank you very much. I think there is just another comment, Janet.
Yeah, I was just going to say it just came in. It's a comment, but I don't see it written in chat yet. Matthew Nordhaus has a question if you want to take it from him verbally.
I'm sure.
The question is, will the confirmed COVID numbers be released to the public on a regular basis? And if yes, where do we best find that information?
Jim, can you answer that, please?
So,
go ahead, Jim.
So I was going to say, I can put together a notification for the board and do the numbers weekly and provide them to the board. And if you want to post them where you think it's appropriate, where people can find the information. After I think it was our last meeting or maybe the meeting before, I'm not sure. I don't know if one of us mentioned that we weren't an epidemiologist, but somebody in town who was kind of reached out. So I've spoken with that person. And she's very nice to kind of help and advise. I sent her the notice that I suggested putting on the website with the numbers, because as we had talked, there's some limitations to those numbers, as we've all discussed, as far as who's getting tested, how many people are getting tested. And so she reviewed that document for me, made some suggestions. I've made those suggestions. I've incorporated those suggestions, and I can provide that document with a number of cases in town on a weekly basis.
So I guess the board, we should discuss it, whether we want to post the cases on a weekly schedule.
This is Mike.
Yeah,
I'm sorry. Go ahead, Kevin.
I was just gonna say, I mean, I would like to make a motion to post the number of cases on a weekly basis or a daily basis, however we could do it most efficiently, and have anyone in town who is the epidemiologist you spoke of to help sort of plot the numbers and see the curve and just make the public aware of what's going on. I mean, I was a little bit frustrated to learn on the news that we had all these cases, and here we are on the Board of Health, and it's a big surprise. So I'd like to make a motion to get that data and post it.
Can we discuss with Scott too? Hello?
Go ahead.
Scott, you were talking, and I think Jim said a week or two ago that the Mass Department of Public Health does not just does by count, list the numbers by county, not by town. Is that still something that they're doing, or?
Some of the towns have actually started reaching out and actually publishing their own numbers. And I think that needs to come from your board on that decision.
This is Mike. I'm not ready to support a motion to do this because I'd like to see through Jim, and I'd like to have an opportunity for the whole board to review the caveats that any good epidemiologist or statistician would put on the release of those numbers. What do they mean? It's great to put out numbers, but until you can tell the public, okay, this curve actually means something. And to give you a hint that this is not easy, or even maybe even in our case feasible, because of the relatively low number of total numbers of the population, much less the total number of folks who are reporting to have symptoms or test positive or hospitalized or recovered, or who are suspected asymptomatic carriers. And I'm only going into the long list, the short list, without some sort of explanation that goes along with the release of the data. I see no useful reason, see nothing useful for the public other than, shall we say, oh, we got some numbers, but what do the numbers mean?
You know, as far as the numbers, it's a very fluid number. I mean, I know I've talked with Jim about this a lot, and we're now on the next phase where the numbers are actually coming off the list because people have passed their quarantine and had their testing. So it's just a constant, you know, it could change literally week to week. The numbers can go up, they can go down, and, you know, and there's two types of testing. There's the
RNA test and the antibody test. Yep.
But yeah, the one that gets logged through DPH, and then if somebody goes to their own PCP, the PCP can say, sure, you're presumptive positive, and you go home, quarantine yourself, and you're not going to get listed on the Maven system, DPH. So it's you know, it's a level of where individuals find out that they're sick and they do the right thing and they stay home and they weather the storm. And then, you know, there's the other ones that actually have the actual test. So it's a very fluid number, and it will change every week as we go forward.
Lisa, what are your thoughts on that? Can someone unmute Lisa?
Oh, I'll do it. I think that's exactly right. I think 6 people versus 60 people, what difference is that going to make to you? You're going to stay home because there's 6 people? Or go out because there's 6 people and figure that everything is fine and dandy in town, or 60 people or 600 people. I don't think testing I think publishing numbers is going to make that much of a difference. You have to wash your hand. You have to wash your hands. You have to stay in. You can wear a mask. We all know what to do. Knowing who has it in town is not going to make that much of a difference.
I also understand that everybody wants to know this information, and we have one source to get us that information, and that's Jim Gareffi. And Jim Gareffi is so inundated with all the calls, all the other things he has to keep track of. For him to have to do this every day would take away from other things that he has to do, all the meetings, the phone calls he's trying to answer. I think it's not reasonable to request that of him.
Isn't there a nurse?
Excuse me?
Isn't there a nurse?
Okay, can I finish what I'm saying?
Yeah.
Please? So I feel it's not a reasonable request, and I also think that everyone, we know it's here in town, and everybody's familiar that once it's here in town, the numbers grow. So I think everybody has to have some common sense, like Lisa said, wash your hands, do the social distancing, do your part to stay away. And I just think that's too much to ask of Jim Gareffi.
Louise, if I might.
Head.
So because we have 16 towns in the district, there are some towns that are asking for that information, so I'm having to put it together anyway. So that message that I've put for those towns gives the numbers, gives what the public health nurse is going to do if someone tests positive, and gives the public health message on it, and also lists the limitations. So again, if it's posted together, it's kind of a complete package of information. And again, I have to pull the numbers for the other towns that are requesting that. To Kevin's point about our nurses, they're on the phone probably 10 to 12 hours a day returning calls. So that's not a task that they're going to be doing.
I'd also like to make a motion to inquire to the Board of Selectmen that we could hire some more staff for public health during these times.
Anyone second that? Oh, sorry, Scott, go ahead.
No, it's Jim. I'm sorry. We've actually we've got 3 nurses. More.
No, I just mean for the town of Littleton.
Oh, okay. All right. Okay. I'm sorry.
Scott, do you want to answer that, or?
No, I made a motion for the board.
Oh, is there a second? Okay, we have no second, so it does not pass. Okay, so if we need to double back a bit so that someone said they stated that their question did not get answered about the LLC staff moving from wing to wing at the nursing home. Can you talk about that, Jim?
So that's information that we're working on to be able to do an isolation quarantine. We want information from the facility on how they're segregating not only the individual, but how they're handling their staff to make sure that the staff is segregated based on the type of work that they need to do within the facility. So again, we're working with DPH and the facility to make sure that happens so that we can do the work we need to do.
Okay, so I guess there's a lot of people on the chat that are typing in their opinions. So if you would like to voice your opinion, you could raise your hand. Scott, did you have something?
Just as we talk about this, I mean, Jim can kind of chime in on this also. It would really be simple for us to kind of put a weekly number out and, knowing that, it could vary. It could vary by 5 or 10 or whatever, and we could, a simple number, I don't think is going to hurt anything to at least put it out there, and it would, I think, satisfy a lot of people's anxiety. And, everybody is running that emotional roller coaster as we go from week to week. And, if we could maybe alleviate a little bit of that, and really know it's just a number. We're not giving out any addresses or anything like that. And hey, if the numbers start to go down, then bonus. It'll might relieve a little bit of angst on some of the folks.
Scott, you should run for the Board of Health when this all blows over.
I'm good.
With the accuracy of the number, the limitations on the accuracy are on the sheet that I'd provide to the board, and the number would be accurate as we know it the day we gave the information, the day we post it. The next day, more cases may come in, so that number may go up and down. But on the day we post it, we can feel comfortable that that's the information we've got from the Department of Public Health.
Jim, this is Mike. I just have a quick question. How many flu cases are in town at the moment?
Without going back and checking with the nurses, I couldn't give you a number right now. I can get it for you though.
No, I'm trying to make a point, and that is that I was just wondering, when you take a look at the numbers and you compare our frequency of COVID-19 disease versus influenza in town, just take a look and we can discuss that later. And
Okay.
the significance of it is that with influenza, it's, shall we say, even more difficult to collect useful information, I would suppose. Is that correct?
I guess there's pre-existing testing that's been in place, and those numbers go to the state. I know early on in this case, I think it's probably going back maybe 3 weeks ago now, there were pretty high numbers of flu cases still circulating, not all in Littleton, but in the district itself. So.
Yep.
Okay, I see that Brian Tarbox and Jennifer Kane, you both have your hand up, but I'm just going to take another comment from Lisa, and then I'll go to either one of you. I don't know who had your hand up first, but we will get to you after Lisa's comment.
So I guess after listening to Scott and Jim, I may have changed my mind a little bit about the numbers. If we can do it on the website, but specifically say that this is not accurate, that this is a very fluid number, and that they shouldn't let their guard down because the numbers are either going down, that there's a lot of variables and that they need some kind of education about that. Somewhere on the website.
Okay. Jennifer, would you like to be first? Can you unmute yourself? Or
Yes.
okay.
Can you guys hear me now?
Yes.
Okay, great. Jennifer Kane, Whitetail Way. I am a critical care registered nurse by training. You guys, I did send you a letter earlier, I think towards the end of last week, so I won't reiterate all of that. But certainly what I am seeing in this day and age where we're connecting to each other electronically, we are hearing, well, there's only one case in town, because that's the only information that's going out there until all of a sudden this Life Care became public. There were people who are like, oh, well, it's so great that we're in Littleton. In Acton, they've got this many. In Westford, they've got this many. But in Littleton, we only have one. So the lack of information, the absence of information makes the public, kind of come to their own conclusions. So providing the information, providing those caveats, providing that training and saying, you know what, okay, we've got 10 cases, but that's all we know is of the people who are tested, that's 10 cases. There are probably lots more out there. You cannot let down your guard. Make that point, but get the information out there so that people know. And for some of us, we may look at this and go, well, it doesn't matter if there are 10 or if there's 100 or 1,000, but for some people it may. And the public deserves the right to be able to make those decisions for their own families, for their own health. And last point is, I'm an RN. My husband's sitting on the other side of me right here. He's an RN. There's lots of us in town who can help out, who won't be able to help you out all the time. But I'm sitting here right now. I'm working from home. I can jump in and help out. Utilize your resources here in town. We're here to help. I would love to be able to come in and start doing some of this stuff for you. So don't let the lack of resources or anything else grab us. We are all here to help you guys out. That's it.
Thank you for that, Jennifer. Okay, Brian?
Sure, thanks. Totally agree with Jennifer's comments. My question that I've asked a couple times, and I don't know that I've really got an answer, is of the staff at LCC that have tested positive, what are the quarantine restrictions on them? Because it sounds like a bunch of them have, and they're already short-staffed. And I would just like to know that, given that it's hotspot, 60 residents and 5 staff, depending on the numbers that you hear, are those people still floating around town? Thank you.
So, Louise, I can take a crack at that. So if someone tests positive and it was a staff person there, they should be, get a call from the public health nurse and told that they need to isolate, which means they can't be working at the facility. They need to complete that isolation with the public health nurse. There are some exceptions to, and the public health nurse knows this, so they can review that with the staff person. But again, if you're positive, you should be staying home. If you're a close contact, you should be quarantining, which means staying home. Because the state recognizes there's a tightness in healthcare staff, they have a protocol for when staff can go back, when it's safe for staff to go back. So. Yeah,
you used the word should several times, and never confuse should with is.
Okay.
And so, and especially given that we're hearing anecdotally, and I'd be happy to hear more definitively, but we're hearing anecdotally that the LCC management are telling staff that they have to work, that if they're not working, they're going to get fired and so on. So should makes me nervous. I would just like to hear for sure that they're not doing, that they are adhering to stuff.
Okay, so two points, and I'll try to answer it. So when we call somebody who tests positive, we tell them that according to state guidelines and state regulations, they need to isolate, which means stay home, not go out until they have a conversation with the public health nurse and are released from isolation. Can't really speak to the specifics at LifeCare because I don't know what their policies are, but the state policies are very specific about people going in with symptoms, people going in who are sick, and how they're supposed to handle PPE at the facility. And again, that's some of the information we're trying to get or feel more comfortable that we've gotten from the facility.
The sad part on this, as Jim says, they should. The sad part is that everybody that's on this call should use common sense. And it's unfortunate that the people out there, not everybody does use that common sense, and people still go out. And that's what's gotten us to the point where if you go out, put on a mask. It not only protects you, but it protects them. Even for those people that don't use the common sense and they're not well and they still go out. And we can't put everybody in jail and make them do that. You can only hope for common sense. Sorry, sometimes you just, bluntly, you can't fix stupid.
I'm with you, Scott.
That's funny.
Okay, so I guess Matthew Nordhaus has a comment, please.
Thank you. Eight staff and 1 resident of Life Care Center have reached out to me through my Facebook candidate page, and I'm
Matthew.
Yeah.
Just so you know, this is not a campaign.
I totally understand. My next sentence is I am not, and I realize I am nobody. I am not connected to the town. I think that the fact that they're reaching out to me because of that is they're desperate and they're scared and they're not getting any answers from the administration there. So I called Chase. He forwarded me to Nina. I've provided the town with all the information that they provided for me, but the comments that they're making and the situation there seems terrible. And they talk about chronic understaffing, about a single CNA caring for 20 or 30 residents, about reuse of PPE or lack of PPE and failure to screen the staff. And a lot of them are scared of repercussions from the management if they if they go public with this information. And they are really, all of them, desperate. Nina has all this information. And I I'm heartbroken at listening to them, and I can't help but feel that if any of your mothers was in that facility, that there would be more of a sense of urgency here. And you know, in all the meetings that I've attended over the last couple of weeks, I keep hearing all the things that we can't do, and I would like to ask what we can do, because I don't think that the corporation that runs this facility is suddenly going to turn around and do the right thing. And there don't seem to be very many employees left. They are all quitting or calling out sick. They're scared and they don't want to go to work.
Thank you, Matthew. Evangeline, I saw your hand up. Do you want to make a comment? You're mute. You're still muted, Evangeline.
My mom is in the facility in the memory care unit there, and I've tried to reach out to as many people as I possibly can to find out more information. I definitely believe that there's some issues around staff going from one wing to the other. There are issues with they're not using the PPE properly. I don't think that they have enough, or they don't have enough staff, or and I don't. I have been reaching the facility and I haven't gotten a response since Thursday morning when the news report came out. It's very hard for me to get a hold of my mother, which makes me also believe that there's not enough staff there. I did go and see my mom this morning by the window, and it was great to see her there, but I also am not sure if the person who was wearing full gear went back out of her room and changed out of that full gear. I just think that the full gear is being worn all day with everybody. And I just don't know what to do, and that's why I'm here.
Okay, so I can appreciate your concern, Evangeline, and I'm, feel terrible for your mom and being in this situation. And it's hard to judge from looking into the window what's going on inside. So we have Jim Gareffi and the DPH that can give us working on trying to give us more information. So Jim, would you like to make some more comments about this? Jim, you're muted.
I'm sorry. I've gotten emails, a number of emails from people kind of detailing situations inside the facilities. Those that are very detailed, speaking from a staff person, documenting very specific things, I have been forwarding to a person that I'm dealing with at the state, Eileen McHale, so that she can see the information that the staff, that our staff is receiving about what's happening at that facility. So hopefully they can use that information when they're working with the facility to kind of test the veracity of things that are happening at the facility. So those messages are being received, and that information is being passed on to the state.
Jim, have they been calling you every day like you wanted them to?
They have so far.
All right.
Evangeline, I just wanted to be sure that you heard about the nursing home family resource line. I'm sorry?
I have called them.
Good. And how did that go?
They just said that they're making the phone calls, and I asked that someone please go into the facility. Please go into the facility. And that would make me feel better if we had somebody in there.
Okay. Okay, Alex, I think you wanted to make another comment.
Yeah, I think somebody else pretty much covered it, but a bit of perspective here. We have a whole world that's doing something they've never done before. And there's going to be mistakes that happen in the process. But what I do know from everything that I've seen and all my experience in the emergency services, I've never seen people work so hard, so fast, so efficiently, with such a desire to do the right thing. There's a lot of moving pieces here, and some of it's going to go wrong. And, the nursing homes and the medical system and all the systems have been built to handle what happens every day. When something like this happens, they don't have any way of dealing with it. They're not necessarily going to get it right at first. That's the unfortunate thing about it being a pandemic. That's it. I'll stop there. Thanks.
Thank you, Alex. So it looks like Christine Nordhaus has her hand up.
Hi, Christine Nordhaus, Star Hill. Thank you. So I just want to understand, DPH has not been into the facility yet. They're just making this phone call daily. Is that correct? Jim Gareffi, or through the chair?
Jim, you can answer it.
So the phone call when we met on Saturday, the requirement was for the facility to call our public health nurse to discuss what was happening in the facility as a way to try to do the isolation quarantine work we need to do. I can't speak to whether DPH has been in the facility or not.
How would you find out? So you don't know that whether or not anyone's been up there to sort of confirm these staff reports or patient reports or whatever?
I don't have any information in that regard. I can certainly ask and see what DPH is doing as far as on-site inspections.
I think the fact that they were so far out of compliance and so resistant to cooperation with the town of Littleton's Board of Health, I think there's a really great chance that those phone calls aren't necessarily portraying accurate information. And so I'm going to repeat that incredibly handsome fellow's question, no relation. What can Littleton do about this situation, if anything? Because there are human people who are loved by other human people up in that facility, and nobody knows if these reports are accurate or not, but I feel like someone should go find out. And so what can this Board of Health do? What can you do? Nothing.
Jim, will you please answer that, Jim?
Sure. So I think we're doing what we can do. We're not the licensing agency. We're not nursing home surveyors. We're not nurses. So we really rely on the agency who does that licensing and who does inspect those facilities and who's responsible for those facilities to hold those people's feet to the fire to make sure things are being done. I think all of the efforts on the town's behalf to get their local elected officials involved, I think those things to try to help put pressure on it, those are the things we can do.
This is Mike. As a matter of fact, what Jim just described is already in progress. And I can well understand the frustration and concern, not only the relatives of folks who are at the facility, but also all residents in Littleton feeling thwarted and frustrated. It appears as if there may be even, I hate to mention this, legal, shall we say, regulatory and legal barriers for the state to simply walk in and begin exerting some sort of, shall we say, regulatory oversight on a basic, what is considered to be a private enterprise. And I do understand that's cold, but I'm trying to remember in detail what was said to us earlier, and perhaps it was said to the Board of Selectmen when they reviewed the situation, what the standing was of the state and the local authorities to in any way intervene, inspect, et cetera, such a facility. And I was wondering if any other board member happens to have the notes on that. I've looked through mine. It looks very much as if it's very limited, but I want to make sure I'm sad to say that's the impression, or sorry, that's the information I have.
Cindy?
I can speak to that a little bit if I may, Mike. So we were, as Mike had stated, the Life Care Center is a private enterprise. We have no authority whatsoever to enter their facility or, go in there, review their policies and procedures. It's really frustrating to us as a board, as it is everyone on this call and our community as a whole, that our hands are tied. in that respect. Town council did advise us that one option would be to obtain a court order, but he advised against that avenue, simply because of time restraints. And as many of you may not know, but I'm sure you can surmise, under the circumstances of the pandemic, most of the all of the courthouses are closed. They're operating on skeleton staffs. Trials are actually being held by video conference. So it would be extremely a delayed process. His advice, town council's advice, was to keep pressure on the Department of Public Health. They're our best avenue and resource to get the information that we need from the Life Care Center. We have Congresswoman Lori Trahan, Senator Jamie Eldridge, James Arciero, are all working very closely with the Board of Selectmen and the town administrator every day, making multiple calls to multiple departments at the Department of Public Health to get support and answers with respect to what's happening at the Life Care facility. We're getting inundated with messages, emails from all sources, and they're absolutely heartbreaking. So we feel your pain. I mean, we fully acknowledge the severity of the situation. One recent development is we had sent a letter to the Life Care Centers of America. It was a joint letter with Representative Arciero, Senator Eldridge, Congresswoman Trahan, and the Board of Selectmen. And the president of the Life Care Centers of America called Congresswoman Trahan this morning. He received the letter, he read it. He promised to her to be a quote, model of cooperation going forward with addressing the situation with the Life Care Center. So she's going to hold him to that. So we're hoping that we can, as soon as possible, be able to follow up with the assistance of Jim Gruffy. Like has said, he's on the phone with them every day, but we do want to get in there. We want to get someone qualified inside there just to review their policies and procedures and see exactly what's going on. So that's where we stand. I don't want people to feel that because they don't see something or they don't hear something, that something's not going on. This is consuming our time all day, every day. First thing in the morning, noontime, end of the day, phone calls are being made from various sources. So it's a very complex situation. And to Alex's point, this is a situation none of us have seen before, and it's very concerning. So I hope people realize we're doing everything in our hands to address this situation.
Thank you very much, Cindy, for that
Sure.
update. Thank you. Are there any other comments or questions? Oh, Janet, what was I? Oh, so I guess we got interrupted from taking our vote to whether or not we want to post positive cases. And so, Lisa, it seems like you've changed your mind. So let's go through and take a vote again. We'll do a roll call since we're on a Zoom meeting.
Well,
Or do we want to just,
I wanted to, with extra care, note those cases, not just blurt it out, put it on the website. There needs to be some education on the website for these people to understand that it's not accurate. It's as accurate as it was when it was recorded, So I guess I would second that motion that Kevin had made, but with a lot of care in how we published it.
Get the caveat, get the wording for the caveat straight, and maybe.
Mm-hmm. Yeah, because it's like Scott and Jim have said, it's in flux. It's changing all the time, and people could be positive and have not been to a doctor. They've just felt sick, and so it's a misleading number. I think if you put 6 or 60 or
It's
whatever.
probably just
but I think it's
grossly underestimated at this point, but what are you going to do?
This is Mike. I think if we're going to have a motion, we're going to be very explicit
Yep,
about
yep.
putting in if the numbers are with the numbers of. I think Jim knows how to basically tersely list the limitations on the significance and current accuracy of the numbers.
Yeah, and Jim probably has a template from the other towns that he can use.
I can provide that.
Great.
Okay, so let's take a roll call vote. Kevin?
Aye.
Lisa?
Aye.
Mike?
Aye.
And myself is a nay. So it passes. So if Jim, you would be so kind as to send that number to us weekly, and we'll maybe ask Joe Layden or Janet to get that posted on the website.
Before we close, I'd like to ask Cindy, if she's still on, just to make sure we're not getting too far ahead of us. Has there been discussion of significance as far as the Board of Selectmen are concerned about the overall, shall we say, approach Littleton wants to use in addressing the epidemic, especially with regard to these numbers?
I don't think I quite understand what you mean, Mike.
What I mean is, do you feel from the Board of Selectmen perspective, all the other things that are going on, that the posting of the numbers with the reservations that go along with them fit in with the Board of Selectmen's, shall we say, overall approach to Littleton's, shall we say, way of going about treating the epidemic?
The response. So to be honest with you, the Board of Selectmen has not collectively discussed the posting of numbers and taken a position on it. So I wouldn't comment to that at this time. I just honestly, I don't think that I can answer your question. I have to be truthful with you. It's not something that we've discussed collectively in great deal nor taken a vote on. So if that's what you're asking me.
Yeah, that's what I'm asking you. And I was wondering, does the other members of the Board of Health, and along with your comments, Cindy, I have a hunch it may be worthwhile for the Board of Selectmen, who have a lot of other things connected with this going on, whether or not this particular posting fits in, helps, doesn't help. Before we post it, I'd like to have them, even if it's an informal wave in. I want to make sure that we're all talking from the same script.
Right, I see what you're saying. Honestly, Mike, we would defer to the Board of Health. If the Board of Health wants those numbers posted, they will be posted. Working closely with Joe Layton to update the town's website, make it more user-friendly and get more information out there. So if, based on this vote today by the Board of Selectmen, we'll certainly add a section to the website that will include those numbers if and when they become available from the Neshoba Board of Health.
Okay, thank you very much, Cindy.
Sure.
Scott, did you have something to add?
Just again, kind of along the line of those numbers. I mean, I talk to Jim daily, and depending on who is updating the website and stuff like that, it would probably be simple enough, that you could post the next morning of what, yesterday's numbers were. And then it'd be, obviously it's fluid, but you'd always have that ability to, post for the previous day. They don't typically get the numbers until, sometime late at night once Maven kind of put those numbers out there, and everything else gets reviewed. And depending on how the day goes, by time Jim gets the chance to review them, it's usually pretty late.
Right. So Scott, to respond to that, I mean, certainly they'll be posted to the best of our ability, and to the best of your ability to get that information to Joe Layton or through the Board of Health. Certainly we appreciate time restraints, and I don't want people saying, calling at 5 o'clock saying, why haven't you posted the numbers? I mean, I think there's going to be some days it's going to work out fine, and other days, who knows if and when that can be posted. So We need some flexibility.
So we're talking, I thought we were gonna do it weekly. You want to do it daily? I'm asking the board here, so let's make another vote on whether it should be weekly or daily.
I'll make a motion to release the data daily with the caveat that Jim provides us with.
Is there a second for that week, for a daily posting? Okay, so that means it didn't pass, so we'll make it a weekly posting. Can someone make a motion for it to be a weekly posting?
I'll make a motion for it to be a weekly posting.
Is there a second?
I'll second.
Okay, so do we have to do a roll call for that?
Yep.
Yep.
Kevin, weekly posting, aye or nay?
Aye.
Aye.
Mike,
Aye.
and me, I guess I'm still a nay. Okay,
Can I just
Okay.
say something?
sure, Lisa.
We want to make sure that, like Kevin was saying, that Jim can maybe give us some wording for the website, not just a number, but
Yeah.
wording.
Which other towns are, can we use, are doing this that we might be able to just refer to the verbiage?
So I provided a document to them. I'm not sure, and I provided PDFs. I'm hoping it all goes up as one document.
Oh,
I don't know how they're using it on the site. My goal was to put it all together with not only the number, but with the public health message, with the message about isolation and quarantine with the public nurse, just so people had a full picture, and the limitations, they had a full picture of what was.
Mhm.
Jim, can you forward that to me and I'll forward it to the board and we can discuss it?
Sure.
Okay.
Jim, just one last thing while I have you. Do you think it would be appropriate at this time for the board to, in regards to the Life Care Center, with all the stories that we're hearing, should we enact some emergency procedures, like the state sanitary code 400.200? When an emergency like this, something like this exists, that we take action to try and correct it however we can by any means?
Sure, I guess it depends on what the means are. I think we're taking the actions that we feel we can, given the abilities that we have and the regulatory framework that we're working with.
Yeah, I mean, people are just talking about, legalities and what we can do, and it's a private organization, this, that, and the other thing. And I think above all, it's about protecting the public health. And
Sure, and I think that's a Tom question as far as the extent of your ability to use that.
okay. Yeah, he did actually get back to me in an email. Yeah, I'll have to read through this whole thing.
Okay, are there any more comments from the chat room? Janet? No? Okay, does the board have any more comments? Oh,
I have something.
Lisa,
We,
go
um,
ahead.
Yep, we talked last week about the overcrowding of the trails. And I think Chief Pinard addressed it on a Facebook video yesterday. I think Conservation Committee and some other people, it was LCV or something like that, the Littleton Conservation Trust, had some postings on some trailheads the other day. So I think between all those organizations, I think it's something is in the works for trying to limit the amount of people on the trails. And there's a new dog leash law too, temporarily on because of the crowding on the trails, that the Board of Selectmen have made it mandatory that dogs be on leash while during this time.
And I guess the other thing that's happening on trails is people are painting rocks and leaving them on the trails for the kids to find. And then the kids are supposed to pick up a rock and take a selfie. And as an attempt to keep the kids occupied and entertained during all of this. So great idea to paint some rocks and let kids go find them, but please do not pick up the rocks and take a selfie, because everybody's picking up the rocks and taking a selfie. So let them look at them and maybe stand there and next to them.
Just admire them.
What, Lisa?
Just admire them.
Exactly. So if you can pass that word on to not pick up the rocks and take a selfie. Thank you.
Louise,
Lisa, what about
where do we leave it with the masks? Are we going to just strongly encourage? How do you want to phrase that?
Right. Well, let's talk about it. I assume Kevin, you would like to strongly encourage masks to be worn every time. What do you mean?
Well, I just think they should be ubiquitous. You know, I think that everybody should have one in their back pocket, and when they're leaving the house, they pop it on, and it's not going to hurt, and it doesn't mean they're sick. You know, it just means that, you know, we're doing what we can to protect each other, and you know, we can figure out sourcing down the road. I don't think we can mandate it because we don't have the supplies, but if we can start to think along those lines, it might just help save Scott a few trips to somebody's house to pick them up, you know?
Okay, Lisa, would you like to?
Right. I think hasn't the governor and the federal government already recommended wearing masks as much as we can outside and as we're shopping for food and while we're outside?
Yeah, I mean, I think we can just do a little better as the, you know, strongly suggests, or, you know, up until we have the supplies, at least for like the public employees that are interfacing with people. You know, I don't know what that number looks like, but how many people do you think interface with people at cash registers, et cetera, on a daily basis in town?
I think you
Hello.
Now you're muted.
kind of thing.
So you were muted.
Yeah, I think, are you getting involved in kind of that private entity kind of thing? Like, is the lady at the post office behind the plexiglass shield who doesn't live in Littleton, are you going to just mandate everybody in town that works in town wear a mask?
Oh, I don't know. We're just having a conversation.
Yeah, no, I am too, but.
I think it would be in the best interest of public health. I don't know what everybody's threshold of dealing with
Maybe
it
we
is at
can,
this point. Scott, what do you think?
You guys, you know, I mean, again, some of this comes down to that whole common sense thing.
Yeah, I know.
I got mine. And,
Yeah, I saw that.
Recommend it. You can
Right,
recommend it. You
yeah.
can't mandate anybody that comes through town say that they have to have it.
Right.
You know, that's unless you're gonna, you know, the mask police.
Right. But what
you know,
about just
like everybody else?
yeah, it's a common sense thing. Can we mandate common sense?
Good luck with that.
Yeah, I know.
Louise?
Yes, Nina.
Just on that topic, I would say that it's always advisable to point to various advisories that are put out by, you know, the CDC or other agencies. And there's nothing that would hold us back from putting on our website and linking to various advisories that are already out there from the CDC saying, these are the types of guidance that the CDC is providing, and we're passing that along to you. And, you know, if the Board of Health endorses it, perhaps if the Board of Health is voted, then perhaps the Board of Health endorses it too. You know, however you'd like to do that. As the chief said, you know, we can provide guidance, but there are very few things that we can require, considering a lot of those details are above and beyond our authority.
Okay, I feel like we can't mandate it, but maybe we can suggest that people, as they go about their errands, wear a mask. Do we need to take a vote on that?
You know, just a quick point on that, you know, stay with CDC, DPH. Again, we repeat it every single time. And so does the media, everybody. It's the same message being delivered by the same people. We're not recreating the wheel. Stick with it.
So you don't need to, I mean, I don't think you need a formal vote, please, but if you wanted to vote it, that, you know, the Board of Health voted to put it up on their website, there's no harm in that. But all you're doing it to the chief's point is pointing back to an already existing guideline.
Okay, would someone like to make a motion for that?
I make a motion to actually just put on the website to follow the CDC guidelines for mask wearing when you are in town, or just follow those guidelines.
Is there a second? Kevin? So we'll take a roll call. Kevin?
Aye.
Lisa?
Aye.
Mike?
As long as it's put up as advisory, I don't want this vote to be just that
No,
we voted to put up a website. I mean, I want to make sure.
put it on the website. Yeah.
Yeah, that there's a vote basically to provide advisory on the website.
And
So for
I'm
that,
an,
yeah. What I'm suggesting here is not Nina's bureaucratic statement, which she was very accurate about. I'm simply saying the vote should be that the Board of Health strongly advises that when you're out and about and in public, you follow the CDC advisory.
Exactly. Yep.
correct. So I am an aye also. So Mike, just to be complete, is that an aye?
Aye, yes.
Okay, so we're all in favor. Okay. Lisa, didn't you want to talk to, weren't you out and you saw some plexiglass being installed somewhere?
I saw this past Monday, I saw plexiglass at the post office, and the desk is 6 feet away from the woman behind the desk. And then CVS has it at the pharmacy and at the cashier. And then I think Market Basket was putting it up. I was at Donald's this morning and they said they're getting it soon. Whole Foods had it, and Market Basket and Westford said they didn't know if they were going to get it, but that's Westford. So at least 3 or 4 places in Littleton already have the plexiglass shields up. So
Thank you for that update. So our next meeting is Tuesday night, April 14th, which would be a regular Board of Health meeting. And we will not be talking about any COVID issues at that meeting. It's at 7 o'clock at night. It will be a Zoom meeting. And then a week from now at 2 o'clock, so that's April 15th at 2 o'clock will be the next COVID meeting. So would someone like to make a motion to adjourn?
can I just ask a question?
Oh, sure, Lisa.
To Janet, I guess, or whoever's doing the website, that numbers, is that going to be going up between now and next Wednesday? Or is that something that go up to, I mean, how long does it take to put that kind of information? I guess Jim too.
I'll get you that sheet that I put up from last Friday. So it'll say 4-3 on it. I'll get you that when we're done this meeting, and then you can decide what you want to do.
Okay, thank you.
Yep.
Thanks, Jim.
Yep.
So Jim, is it every Friday that you do that?
That's what I'm going to try to do, so I can go through and put it together get it all together for all the towns and get them out to you.
Okay, thank you. Is there any other thing?
Louise, I just want to say thank you to the Board of Health for everything you guys are doing to field questions and answer questions from folks. On behalf of the board, myself, and other staff that are fielding a number of other details ourselves, thank you for everything you guys are doing.
Thank you, Nina. Okay, so would someone like to make a motion to adjourn?
I'll make a motion to adjourn. Oh, sorry, Mike.
No, it's okay.
Is there a second?
Second.
Okay, this meeting is called to adjourn. Thank you, everyone.
Thanks.
Thanks.